Imagine a healthcare system on the brink, where hospitals are scrambling to keep their doors open amid looming threats to funding. Now that's the stark reality facing Massachusetts right now. And it's a story that could affect us all. But here's where it gets controversial. Is this state bailout just a band-aid on a deeper wound caused by federal policy shifts? Let's dive in and unpack what's happening step by step. So even if you're new to the world of healthcare politics, you'll get the full picture. On September 25th, 2025 at 2 p.m. UTC, a glimmer of hope emerged for Massachusetts' healthcare landscape. Leading hospital networks, including powerhouse providers like UMass Memorial Medical Center and Tufts Medical Center, are set to benefit from a substantial $234 million infusion of state funds. This financial lifeline comes at a critical time, as these institutions grapple with mounting economic pressures and anticipated reductions in support from the Trump administration's policies. Governor Maura Healey took decisive action earlier this week by approving the legislation, which allocates $122 million specifically toward acute care hospitals. These are the frontline facilities handling emergencies, surgeries, and intensive treatments. Think of them as the high-stakes heroes of medical care. Additionally, $77 million is earmarked for the Health Safety Net Trust Fund, a vital program that compensates hospitals and community health centers for providing essential services to those without insurance or with inadequate coverage. And this is the part most people miss. Community health centers, which often serve as the first point of contact for preventive care in underserved neighborhoods, will receive an extra $35 million to bolster their operations. To clarify for beginners, acute care hospitals are where patients go for immediate, serious medical needs, unlike long-term care facilities. The Health Safety Net Trust Fund acts like a safety net, ensuring that no one is turned away due to inability to pay. It's a cornerstone of equitable healthcare. For example, imagine a single parent needing emergency care for their child. Without this fund, the hospital might face losses that could lead to cutbacks in services. But let's not sugarcoat it. This move sparks debate. Critics might argue that relying on state funds to counter federal cuts from the Trump administration highlights a flawed national healthcare strategy, potentially leaving states like Massachusetts to pick up the slack. Is this fair? Or does it expose inequities in how healthcare dollars are distributed across the country? And here's a thought-provoking angle. Some might see this as a necessary shield against political volatility, while others view it as government overreach that could stifle innovation in private healthcare. What do you think? Should states have to bail out hospitals from federal decisions? Or is there a better way to ensure universal access? Share your opinions in the comments below. Do you agree this funding is a lifeline? Or do you see it as a symptom of bigger problems? Let's discuss.